Carlos Nelson with Cascade Media Group, and today we have a health specialist in suicide prevention for teenagers. Who do we have here?
Yeah, so my name is Taylor Cline, and I am the Youth Suicide Prevention Specialist at Tri-County Mental Health Services.
Hey, Taylor, tell our audience a little bit about what your job entails and talk a little bit about teenage suicide.
Yeah, so when I tell people what I do for my job, I always have to make a point to describe what it means when we say prevention. So a lot of people assume that I am working one-on-one with youth who are actively suicidal. And I do not do that. That is what we would call an intervention at that point. So what I do is I work with schools and other community organizations to provide mental health education, suicide prevention education, to provide a lot of those skills that youth need to cope with the emotions and the challenges that they're going to experience in life, as well as the skills that they need to reach out for help when they need it, or if a friend needs it. So I do a lot of educating. I do a lot of handing out resources, developing social media content to reach youth where they're at. So that's kind of an overview of what I do at Tri-County.
Tell me this, with all these mass shootings at schools and at places where our children are at youth, from your perspective and in your lane, how has that affected the teenagers and the youth that you've come in contact with?
Yeah, it has a very significant impact. I think over the past few years of the COVID pandemic, youth have experienced a lot more stress, a lot more expectations on them, especially, safety precautions and things like that. And so on top of that, they've got all that stress building up, but the fear of possibly going to school, which is a safe place for many students, and having to live with the fear that you might, become a victim of violence in that school setting is very terrifying for a lot of youth. And it does, we do see in the data that it does definitely have an impact on their mental health. I think it's important to understand that when we talk about these school shootings as well, that it's not a one-way street. So it does have a negative impact on the youth who are in those schools when they're being, attacked by an assailant, or when they are witnessing it on TV or in the news. But the reality is that this is very much a mental health issue, and it is a suicide issue. And so it's important to talk about the fact that there are a lot of youth that feel like there is no way out, and a lot of these shooters are actively suicidal, and they see that as their means of taking their life. So it is very much a chicken or the egg, which came first kind of conversation.
All right. Tell me this. You mentioned the pandemic, being cooped up, the frustrations of not being able to attend classes and all of that. I want you to talk about that in mental health, and then I want to change the subject to bullying. Okay.
Yeah, so talking about the pandemic and mental health is a bit complicated. There's still a lot of data and information we don't have yet. We have not seen a whole lot of data coming out to look at how the quote unquote lockdowns impacted youth. So social distancing, virtual education, masking. But we can, understand that youth really need a lot of structure and a lot of routine to thrive. And when that is not in place in their school setting, that can have a very significant impact on them regardless. Something I have noticed is that the adults in our society tend to have a more negative perception of things like virtual schooling than the youth themselves have. There's a lot of accessibility issues that can be addressed with virtual education, particularly for students who are maybe have an intellectual disability or a physical disability. It expands access to them. It's a complicated issue. It's hard to say the direct impact. We do know that suicide rates went down initially when the pandemic started. We have not seen that continue on that trend. And we did notice an increase in emergency department hospitalizations for youth. But the problem with that data is we don't know how many of those youth were experiencing suicidal ideation, or if they were self-harming and accidentally went too far, or were using substances and may have either intentionally or unintentionally overdosed. It's a very complicated landscape, and I try to avoid making broad, overarching statements about the impact on youth mental health, because we don't know yet, unfortunately.
All right. I was talking about bullying, but I want to go back to you were talking about data really and number crunching. Is there any difference in these rates with different ethnicity groups?
Yes, so we know that African American youth, Black youth are at significantly higher risk for suicide, up to 7 times greater risk for suicide and mental health challenges in general. This is also the case for Native American Pacific Islander youth. So there's definitely an aspect there that is very buried within, kind of the variety of factors, socioeconomic factors that also impact race and are impacted by race. So we have noticed that there is a lot of data that shows that, unfortunately, those youth, Black youth and Native American youth, are at higher risk.
All right, let's talk about that next subject. As I said, bullying. That was really a headline issue over the last 3 years. It seemed like it has died down. Talk a little bit about that and how that's affecting the mental health and suicide rate.
Yeah, so bullying is, I wouldn't say that the conversation has died down. The conversation has changed quite a lot. The conversation has changed much more to cyberbullying and the issue of cyberbullying, which bullying in itself was always a hard issue to address for a variety of reasons. Cyberbullying makes it much harder to address because it's outside of the school environment, so it's not in where teachers or an adult can see it often. It can be persistent and anonymous, which can make it very hard to track down who's doing it. As far as regular bullying goes, though, we do have a lot more recent data, particularly from the Trevor Project, which is an organization that serves LGBTQ youth, that shows that LGBTQ youth are significantly higher risk for being bullied, and also by extension being affected by mental health challenges, including suicide. LGBTQ, particularly transgender youth, are at much higher risk for suicide than their straight peers.
All right. In closing, how about you bringing our community up to date on exactly what Tri-County Health is working with and projects that you're involved in, and as I said, what do you have to say in closing?
All right. Yeah, so we do a variety of things in substance use, suicide prevention, mental wellness in general. Recently, we have launched what's called a Meaningful Meals campaign, and this is supposed to increase connection and resilience in families by encouraging them to decorate what we call an unplugged box, which is just a little shoe box we provide at community events. Families can decorate them, and then in that box goes their phones at dinner time. And then we provide these conversation cards, some little placemats for kiddos to draw on that kind of connects them to that message, but encouraging families to have more conscientious conversations about mental health, just what's going on in their lives, instead of, staring at the phones while they're eating dinner or watching TV. So that's one thing. We also recently launched a youth wellness website called growstrongkc.com. And that is a website that takes kind of a blog format, but this is something we've been working on for a very long time. And it's a way to provide mental health education, substance use prevention, suicide prevention, bullying prevention information to youth in a way that they will actually read it and interact with that content. So we're very excited about that. It's something we've needed for a long time. Variety of other things. We have some coping programs like How Full is Your Cup and Camp Mindful that we provide to schools. And they just work on, helping youth acknowledge that stress is a normal part of life and that we have to find productive ways of dealing with that stress, and acknowledging that we need to teach that to kids and not expect them to just learn that on their own, because often they see that behavior in other people and tend to mimic those unhealthy coping skills. That's just a few of the things that we do. We do a whole lot of things for sure, but those are the big ones. And I do want to highlight that Tri-County Mental Health Services is working alongside other mental health agencies in the area to expand our crisis care systems for the 988 line that will be launching on July 16th. So that's kind of like 911, but for mental health crisis situations. And we're hoping that that will connect more people with professionals who are qualified to de-escalate and address mental health crisis situations, and hopefully take some of the burden off of our police departments and hopefully keep people out of prison, jail, places that they don't need to be, and into places where they can get the care that they need. So the National Suicide Prevention Lifeline, that 1-800-273-8255 number will still be available, but you can now easily reach it by text or by calling 988 starting July 16th.
Wonderful, wonderful, wonderful. As we like to end in our closing statements, when you invest in your community, you're really just investing in yourself. Good night.
The program is brought to you by the Kansas City Business Association.